Welcome to the Compromised to Alchemized podcast, and I'm your host, Dr. Neel Bulchandani. Excited we hit record. We're officially doing this. So both of us took some work to get to this point, both with our schedules, but also with the recording world. So yeah, I'm really excited to talk with you. My podcast, as you know, is called Compromised to Alchemized, and I really focused the first 10 episodes on embryology, and the last 10 have been more about airway and feeding health. And then I'm kind of getting into a little bit more of functional in the next 10 here, functional assessments and just kind of what we were talking about, the simplicities of life, but also how profound that is. So I know you're going to talk about way more than this, but chewing is such a massive topic. So you do not need an introduction to most of the people that we know. But for anybody out there who's tuning in, this is Mary Bourke, and she is CEO of Myo Munchie, a very amazing, tool instrument that many people around the world use. But yeah, Mary, I know you are a chiropractor, 30 years, SOT, sacrooccipital technique with craniopathy, advanced training. And you're this chiropractor that does all these wondrous, has had all these wondrous trainings and doing that. And then also you have this amazing thing where you have a dad who, Kevin, right, who is from your homeland, Australia. And you grew up as the the daughter of a dentist. And so there you are with this company, in that it's like such a merging of function, movement, dentistry. So I think it's quite fitting that you run it, and it's quite fitting that you have made it your life's work, I would say, if I could say that, not just around chewing, but orofacial function, and talking about the simple and yet the profound effects of that, and how I love that you used the word stomatonathic, because I talk about the stomatonathic system a lot. So we can have you define that for us in a little bit. But just, there's so much that you value. We're going to get into a lot more of that. And, this phrase that I know you said, which I love, is that you look at movement, and you look at, this way to have us express our optimal DNA, the optimal genetic expression. But I love that you have this like really central way of doing that, using the Myo Munchie, but more the education that you provide and the support that you and your company provides, and all the practitioners around the world that are advocates of it too. So anyways, that's my intro of you. I'd love to have you say any more about kind of who you are and what you're really focusing on, and then we can go from there.
Hey Neel, thank you so much. It's great to be here and have the conversation with you. And I love what you've just said there in the intro, because yeah, it is my life's work. It's the bit I'm hoping to leave as a legacy. Mm-hmm. And yeah, it has been really interesting as a chiropractor to end up running a company that produces a product that was designed and developed by a dentist. And yeah, it's a unique role that I get to play, because I have this privilege of bringing my view of the world, which is all functional, from that chiropractic lens of, our view of the world when we're looking at who is the patient we're working with. And that's what I've really brought to the table with our educational understanding is the broader context of what's going on with health, and how we can have such a profound impact when we're working in the orofacial space. And so I've really enjoyed this journey of getting out there and connecting into the community of amazing practitioners who are all busting out of their lanes, because every practitioner who's working in this space on some level is doing different work to the rest of their peers. And I think whether you're a speech and language pathologist, whether you're a dentist, whether you're a chiropractor, whether you're an osteopath, whoever you are, you're slightly unique in what you're doing. And so we all come together, these people who have all kind of come out slightly from them. The majority of their work is based, most of it didn't learn this at uni. It's not part of our program. And even though as chiropractors, it really makes sense for us because it's like, oh, of course, there's this whole other area. And once I started to really look at orofacial myofunctional therapy and the understanding around a lot of that work, and then in with the dental understanding I had around malocclusion and TMJ function and all the things, I started to realize that oral posture is the same as body posture. It has all the same components, and we need to see it and grow it and give it as much attention as we do the body posture. And that's what I started to get really interested in, is that early. How do we get some really early influence there? Because that's always been my passion in my chiropractic. Go early, spot these issues early, and we can do so much to work with them.
Yeah, it's and it's really I want to dig into too also the chiropractic, maybe delve a little bit deeper, because um I mean, I love what you said though, but before I say any more about that, is that we have all of these amazing people that I've loved collaborating with, and many, we know so many people in common. And it's the oro prefix is so fitting, because it's like you take any one of our fields, and most of us didn't have any idea we were going to get into this. And so you add on not just another thing, like you have, your SO, so specialized with SOT and with craniopathy beyond that. But it's kind of like that was all specialization after specialization. And then it's not like you just take on airway and chewing and you add that on as a top layer. It's like, no, that becomes the very foundation of how you look at everything. And so it's kind of interesting because you have so much of the wealth of SOT and craniopathy, more than a lot of other styles, techniques in chiropractic. There's very intricate. And then you have the aspect of the airway, which then in one sense it's like, but that undergirds and it makes SOT and craniopathy work when you apply it. I don't know, that's getting into the weeds a little bit, but I feel like there's corollaries with that within dentistry, within of course we can add in all the different fields, the lactation and then myo. It's like, if we understand this whole problem, the pharyngeal arch formation issues that happen in utero, then it actually gives us so much more understanding of what is even this field that we found, because it gives the field the right expression. So I kind of haven't explained it that way, and I don't know, there's more to that. So how, like, tell me that I haven't asked you this, I haven't thought of asking you this, but tell me, if you could go back in time and you imagine Mary right before becoming SOT practitioner in craniopathy, stumbling across what you know now.
Yeah, well,
What?
interestingly enough, when I first graduated,
Uh-huh.
parodontics was
Oh yeah.
did when I first came out. That was the framework. So
Yeah.
I was already doing SOT when I finished
Uh-huh.
uni. So I landed in the chirodontics paradigm straight out of uni,
Uh-huh.
which is interesting, but it takes a long time. It took a long time to actually get right back to the basics, because that's a really great system and really complex for cases that are really complex. And it's brilliant for, really trying to work with those who've got big issues with the way their whole system's formed in adults.
Mm-hmm.
That's what that chirodontics model was about. So I had that as a framework. And then eventually over years, I just started going younger and younger and younger and younger, because it's so complex to solve. And
Yeah.
so, no, I didn't. It's probably more as I went along, I started to get into the pediatric side of things, and I started to understand all of the primitive reflex work. And I got really
Mm-hmm.
interested in hemisphericity and all the different areas of influence you can have in growing that little human early on, and particularly in relation to early body movements and how they affect and impact brain growth, development. And no, I didn't know about the really important role orofacial function played in that. until the last 10 years when the light started to twig that chewing is one of those movements that I'm banging on about all day. You got to roll, you got to crawl, you got to do it, all the things. Actually, you got to chew. If you don't chew, you miss these amazing milestones where the brain is waiting for the next piece of information to lay down the next program. And that's what I spent a lot of time educating parents and things about all of these other movements and how important they were for that same sort of development. And chewing is the thing. Chewing, you have to go from sucking as the main functional movement, suck, swallow, breathe, and you have to go to chew, swallow, breathe. And chewing is the movement that will take you through life. Chewing is the thing that you need, and that is the functional movement that will allow your feeding and speech programs to get loaded the brain. And it's that was the piece that I had no idea about 30 years ago. And had been in practice for a very long time. And I still see it now with chiros who've been around a long time and really know that neurodevelopmental work incredibly well. And when you can start to give them this information, they're like, oh yeah, right, okay. Essential bits of information that kickstart the whole system.
I'm curious. You set me in several different directions, and because I, don't often get a world expert in chewing, right there across the video with me. Although I'm really loving the fact that we can now chat via WhatsApp, which is really cool. What do you see? Do you see this happen? And I know, so not that we have to spend as much time on this, but how do you see, we'll kind of go right back to kids here in a moment, but with any of the older population, when they go through prolonged periods of fasting, do you see that play a role in any issues they're experiencing? Have you kind of taken care of anybody with, especially if they're like in Ramadan, or maybe they're in Lent or whatever traditions they might be, and they are just going, or maybe it's for detoxing and cleansing. I think we can say probably, or somebody's on a juice cleanse and all they're doing is juice, Tell me about that. Do you have any insight there?
Yeah. Now, you've raised some fantastic questions there that I've never thought of, and I love that. And clinically, I'm going to look out for that now because it's a great concept as far as the traditional and the fasting from those sorts of things. Definitely with the certain dietary choices, and we're definitely seeing it with the smoothie juice thing for sure, and particularly with children with the nutritional because they're getting the facial growth. But also, I think it's a huge factor with adults who, a lot of that temporomandibular joint, there's just no strength around that stability of that temporomandibular joint and the function there. So I think that is definitely, that's a simple way to sort of look at it. But no, I haven't seen, I'm not tracking it as well. And I've been working mainly with children since I've had this lens on in my life. But definitely that lack of chewing function is a really, really, and I think, we're sort of on the same wavelength with that. And I can definitely talk more detail about that, but I can't specifically tell you of any cases I've had. It was interesting when Dad was alive, there was a book. What was it called? Raw. I think it was called Raw. Victoria Buchenko was the author's name, and she recommended the munchie in the back of that book because there were a lot of smoothies and it was things for vegetarians, and make sure they were getting that opportunity to chew, because she had made that correlation that you're not getting enough chewing when you're using these smoothies for nutritional delivery of nutrients.
I love that. That's pretty great that she put that, because that's like, that says
That
a
was like
lot.
20 years ago. That was
Wow.
that was ahead of the game. Yeah.
Oh my gosh. Well, the the thing you said earlier, which made me really kind of intrigued too, and so we could circle back to this, especially with all you've seen, especially in that pediatric population. But that's kind of where I want to go into too. These movements, you're mentioning with studying, early movements and, the movement that these precious infants make. And then as they grow, can you tell me, like, yeah, paint a little bit more of that picture of how richly the movement informs the nervous system, brain, and vice versa? If you could speak more to that.
Yeah. Wow. Yeah, the physio, I'm just always blown away by the nuance of the physiology and how profoundly finally it's tuned to the
Hmm.
pieces of information that are coming into the brain from the body, and how it's informing the next activation of the next piece of growth. So, for example, let's think about um, when the babies so when we have these first, the baby arrives and they're in this curled state. Let's talk
Yeah.
about the baby first arriving it. And then they're going to unravel. So that process of unraveling, they're unraveling. So each day that baby's changing, and all the muscles have got to be in relation to the joints, in relation to the each other. And it's quite fascinating how the brain is able to give just the right amount of all of this is required to get it all occurring, and the right. So it's like that first 6 weeks and the baby starts to get their head up, and the eyes are a big part of what's leading that, because the eyes are starting to lock on to the parent. They start to smile. That starts to happen, and then they hold the head stable. And this is all programmed, and there's these ocular head riding reflexes, and they're all in combination with the vestibular system and the little bit of balance. And there's all these amazing nuances that are going on with just the right amount of input that's then allowing the brain to make the calibration required to get it stabilized. Like, I just get blown away by how that program is playing out, and we have to be so careful we don't interfere with it. And this is what I'm very passionate about now, is just trying to make sure the parents aren't in this modern world of haste and going somewhere all the time, and in a container, in a capsule or a car seat or a pram or whatever they're in, or wrapped up too long, or all the different things. They're missing these moments where the brain's trying to get that exact calibration of where that head should, the skull should land in relation to the top vertebra, which should land in relation to the temporomandibular joint, which then should land in relationship to the eyes and how they're locking, all the things. And it's
Mhm.
all mapped so perfectly, and it's all there. We've just got to get out of the road far enough and put the right inputs in and allow the opportunity. And I think that's what I, am so passionate about. How do we, and trying to explain it in such a way that people
Mm.
get it. Oh, rolling is not optional. They have to roll. They have to have opportunity to move, because that's how the brain is working out when it's ready to load the next bit, and how they've got to do these, and then there's small windows. There's small windows where things should happen. And it's not over months. It's over like a 2-week window that'll be ready to load. And if you miss the moment, then the brain will work out a way to go around it. And you're looking for ideal, and you're looking for the way it'd all load ancestrally, not because that's the tricky bit, isn't it? How do we even find the bits, because it's getting so hard to have
Mhm.
the
Yeah. No, that's, yeah, it's there's so much there. Yeah, that's like um you put so much, right there in this, like, very technical but really simple way too. It's like, this is we are meant to have this. And I know what you were speaking of. It's like we have all this, technology and strollers, and these things are good, we need them. Yet at the same time, it can be so easy, because there's so much that we're trying to do or maybe accomplish, or it could, and you have to get places, and there could be so much where you, like, I can think back to our times with our little ones, where it's like, well, yeah, we gotta get them out of the car. I'm just gonna take out the car seat because I know I'm gonna need to set them down. And if I have, like, all the grocery bags in my left hand, so instead of taking them out of the car seat and then holding them, and then maybe there's a little time for them to, like, maybe not through every aisle of the grocery store and the floor is not that clean, right? We don't want that, but there's ways to like let them move more than what they are moving. And I think we had to really work hard as parents at catching that,
Yeah.
because we just, we didn't know. We were just like, yeah, of
Yeah.
course we know movement's great. However, you can just
Yeah.
start to let practicality, so you think, or
Yes,
pragmatism, so you
conveniences
think,
are
yeah,
the issue.
convenience,
Yeah.
when really it's such an inconvenient thing for our bodies to not get this nutritive. You talk about, yeah, I know you talk about this in other ways, but to get this nutritive quality, which movement is nutrition, it's nourishment. So yeah.
Yeah, it is very much. And I think that's what it's that idea that it's not optional, it's essential. Similar to the idea of we need certain nutrients in our food and things as well. We need these certain movements are essential for human genetic expression. And
Mm-hmm.
that's where we need to really be aware of. And I think, yeah, it's something I've really noticed too. It's a long time since I had my children. Well, 20, they're in their 20s. And things have sped up a lot since then. And one thing I really realized recently was, because a lot of children are in babies that are in daycare early, is it's the safety factor. So one carer might have a number of babies to look after. They won't get as much floor time and explore time as they should, because they need to be safe, and they'll probably be in a contained situation a lot of the time. And I realized that we're sort of, we're trading off conveniences and safety and things like that on these essential functional movements that are trying to, that first couple of years of life is so important for how that human can function later in life. And so that's probably the most important thing. So it's making sure that if you know your baby's in daycare and that you're thinking they might not get as much movement exposure, you want them safe and well, and when you pick them up at the end of the day, but we have to be so aware of what those milestones are and how they're meeting them, because the earlier we can spot that, maybe they're not rolling and they're 4.5 months old, what's going on, or 5 months old, that window is going to start to close and they'll be on to the next thing. And so there's things you can do to encourage that. So if certain babies don't roll, certain babies are going to be not automatically rolling. And we want to get in there and we want to get that rolling movement happening for them. And that's where people like you and I, Neel, are very helpful people in the community, because we can spot that and work, okay, why isn't that happening for them? Because it
Yeah.
should.
Yeah.
Is it lack of exposure? Is there a subluxation or some issue in the system that's not allowing that correct messaging to be firing all the way through? But the sooner you can pick it up, the quicker and the smaller the intervention required. And that's what I'm always super interested in as well. With anyone I ever see at whatever age, what's the point of original dysfunction that created this symptom picture we're looking at? Because that's what you've got to find. You've got to find the point at which the nervous system couldn't manage itself anymore, and it created an adaptation or a compensation or some other way to do it, because we're very clever. We will find another way around. But what you want is the most straightforward functional path, so that you get the best outcome, because it will at some point hit a point at which it can't adapt anymore if we start doing these compromised versions. Yeah.
Yeah. Yeah. Yeah. No, it's good. It's like the wheels turn when you talk, Mary, because you can tell there's just elucidation. I see there, like the way you're synthesizing like so much all at once. It's like, oh, I was thinking of this earlier. You have your vast, orofacial understanding, chiropractic, but you also sound like you borrow from the brains of PTs and OTs, and I know they love your work so much because they're looking at all these. Yeah, and you could just nodding, I know, right? Because it makes so much sense.
And I think that is what I have loved so much over the last 10 years of doing what I do. I get to connect and hang out with all these different
Yeah.
types.
Yeah.
And it is so interesting, because we all have these slightly nuanced views that give you we really do have to work collaboratively, because
Hmm.
sometimes we can be absolute experts in our thing, but we're kind of missing this little bit over here that would make all the difference to our outcome. So it's really, that's a big part of what we're trying to do as well, is to have a centralized education platform that has education from all the different practitioner types, so you can get that different lens. And I've got other who present on our behalf on our Munchie U platform. And I love that because, you know, we often do spend all our time in our own educational lens.
Yeah.
And it's great to be experts in our field, and that's really excellent. And we do need that, but it's I'm becoming more and more of a generalist as I go along. The more I know, the more I'm kind of like, oh yeah, wow. And my dad, you know, that was my dad all over actually. When I look back after 50 years of dental practice, you know, the last 20 years of his life was spent thinking. He started getting really interested in the chiropractic side of things because my older brother's a chiropractor as well.
Oh, okay. Okay.
And that became, he was like, oh, it's all connected. And you can think you'll know it all after being in practice for however long, and you'd be the same. You just start knowing more and more, and then you realize, oh, there's so much more to know.
Right. Yeah. It's why it's so good to collaborate, because there's no way we can ever know anything, but it's also like, and that's, you know, but it's like, when we look at the world as, we are not separate people, we are all like one, then you get around people and you realize you cross synthesize, osmosis, and pollinate. And it's like we're all thinking together in a way. And I know that's what collaborative care, interdisciplinary care, but I almost find sometimes those words are just a shade short of the beautiful oneness and togetherness and community that we all can have, because we're one collective. And really, we're all like gathering around a huddle to solve this problem where everybody, almost every single person, is experiencing, and everybody is to some degree, and some more than others. So I think it is kind of like we are in one way. It's like when you have so many who value what Myo Munchie has done, and then you have you as a person who's carrying forth this work with your own expression. And it's like, when we connect, and just even you and I in our interactions, I'm like, I feel like I'm more myself, because you bring to me something that fills in what I appreciated and know some about, but then of course this walloping wave of expertise, and I'm like, oh, that's, I can feel the broader mind is being nourished. And so I think it's so fulfilling and so enriching. And I know that so many, like you could say that so many would have that experience when they come in contact with what you're doing. So, you know, thank you for it. I've said it, but I really want to say thank you for carrying on, both the legacy that was handed to you, but in the baton that was handed to you, but then how you're bringing it, you know, in a way that, you know, only you could bring it, and to, you know, to this broader scope, this broader world, where it's like we need it now more than ever to know how simple it can be to course correct a massive, you know, issue that's been going on. I know you mentioned some of these ancestral, they, you know, when we are in touch with our ancestry, we see how much we've lost. And yet at the same time, we can also say we can, it's not all, um it's never too late to regain some hope, health, and function when we can tap into, you know, some of these really core basic elements of life, you know, community and oneness and togetherness, but also, you know, the village that it takes to really have our lives work. And so you have so many, this, you know, families, because necessarily if you're focusing on these, you know, these babies and helping them, you're helping the dyad and you're helping the family unit, and you've seen families, you know, come into a better place in their lives because of a very simple concept that, you know, you're heralding. So, you know, and I want to say that's kind of, that is like the the fundamental basis of my podcast came it was called embryology when it was just about, early life and pre and perinatal psychology. And I loved that. But then I said, no, it's time to shift to a broader message of how can we all go from a compromised airway to an alchemized airway? How can we go from compromised to alchemized? And how can we, as families that are facing this issue, do this impossible thing, which is to take this lead, to borrow from the alchemy phrase, and turn it into gold? That's not linear. It's not magic at the same time. It's complicated, but it's possible. And I think like chewing is alchemy, in a lot of ways. And what you're bringing solves that.
It's very cool, and I was going to tap into the name of your podcast as well, because I love it, because that's exactly right. It's not a linear relationship between compromised and alchemized, and that's what I'd love people to understand about their health. If you can find the way in to where the compromise occurred, boom, you can get to alchemized.
Mm-hmm.
It's not about A plus B equals C, and that's what we need to kind of break out of. And I think what the chiropractic philosophy allows us is that we've all seen those miracles in practice where you do a simple thing and wow, this person's life changes. And it is when you can tap into the nervous system, the master control, you can have profound impacts. And that's what a lower third of the face has over a third of the brain real estate of sensory motor. Like, it's got a huge amount of real estate going on here.
Yeah.
It's got the very complex feeding, communication, swallowing, the nasal breathing as well. When you get that working well, every time, and like the swallow, who knew that swallowing was like, I heard it described by Derek Nordstrom, who is an amazing genius in this space. If you ever get the chance to listen to Derek Nordstrom, he said the swallow for the human is like the purr for a cat. You will know a cat will survive if the purr is there. The human swallow, it's our way of resetting. Every time we do it 2,000 times a day, we have this opportunity to reset our neurology. All these people who've got dysfunctional swallow patterns are like, they're pushing it uphill all day long. Mouth breathing and dysfunctional swallow. Who knew?
Yeah.
That means you're working every time, whereas you should have it. You should have access to that every time. So this perfection is in there. You're programmed to have this amazing opportunity where when you swallow, the tongue goes up, hits the soft palate, activates the vagal tone, two hemispheres come together, nasal breathing, self-regulate, all the things.
Yeah.
Self-regulation should occur. We should be tapping back to that. But instead, we're all firing off in the sympathetic nervous system response and driving into that overreaction all the time, because we're missing that point. We're kind of disconnected from, whether it was already disconnected in some way with mouth function, like you're looking at, whether that tongue wasn't ever able to do that suck, swallow, breathe, and get that action. But that's what should be happening in that first few months of life. Now, it starts in utero, and then it should be really fully actioned. So by 3 to 4 months of age, that baby should have that gift for life should be in.
Yeah.
And those dummies, those pacifiers are sitting in there, and people have no idea what that's doing. It's pushing the tongue down low and affecting that swallow and that tongue from coming right up to the palate. So that I think that idea of alchemized, and I think when we're working in these communities and the people who we're all busting out of our lanes and coming together, we are this kind of unique community. And there's such a great feeling at any of those conferences and events where you come together and you are your different professional types. And I have a profound privilege of being a practitioner, bringing a product. And I feel so passionately about that product that it's such a great connector to all these different practitioner types, because it's unique. We all access it for different reasons. And I think it is a really powerful, simple concept. But if you can use this tool as a bridge to improve the nasal breathing pattern. It won't fix it. There's a reason why they're not nasal breathing, the mouth breathing. It'll help retrain that swallow pattern. And that's so profoundly important, as well as develop the chew responses to get the jaw strength and stability, to hold that airway open. So it's
Yeah.
a huge part of getting to that alchemized end of the
Yeah.
spectrum.
I love that. It's and yeah, I was I couldn't help but think about as you were explaining um the origin of all of this. It's so that suck swallow but it's like the chew gets developed with the suck swallow. It's so much the order of operations. If we're talking like math, it's like we have to appreciate what happens in utero and what happens in those early couple months, setting the stage for these later moments. And we couldn't help it today. I was Matten was working on this precious 1 month old, and and of course the mom had been using the pacifier because things weren't working and there was struggles, and yes, there was a tongue tie, lip tie, cheek ties. And but the floor of the mouth was so rigid. And as soon as I felt it, I knew, okay, well, we got to get that. Let's see, can we get that loose? Um, and of course the maxilla was just too high, that high on vault, but the palatine bones were way too low because the posterior aspect of the tongue restricted, wasn't lifting those palatine bones in the proper motion throughout, from 4 or 5 weeks in utero. That's talking like at least 30 something weeks of suboptimal superiorward pressure from the tongue to the palate. So then, it's interesting. So kind of the short of it is we worked on these areas, and um, the ileocecal valve of the colon and the parathyroid gland, and that was fine. Yes, but then I switched baby over to the right side, mimicking breastfeeding on the right. And what I see on, like, 99% of these babies is as soon as I switched them to the right, simulating if they were breastfeeding on the right, the mandible becomes more retrognathic, and then they start to have exacerbated, manifestations. So the parathyroid gland misaligned even more. And I just think it's so interesting to think how, for me, it's so simple now to work on these little precious beings because it's a very clear pattern that I see. But to though but so this is for you too, Mary. It's like something that you see and and it's at this point in your life so simple, but then when you explain it, it's very intricate. So for these families who are like, I don't know how to even get this baby to suck and nurse as well as I want, the things that we do are like alchemy, because it is what we're doing, yes, but it's that their little one went from not being able to do something that's so essential for life to being able to do it. And that is really a non-linear results of like gratitude, emotional expansion. And it's not just a simple, oh great, that's working. No, no, no parent says that when you have these moments happen. They're like, you gave my kid, if they're talking about like the benefits of Myo Munchie, like you just gave my child something that I didn't even know could get that much better with their sensory system and with their sense of equilibrium. And I just think of all these things that the Myo Munchie is allowing to happen because of its, like, very 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 special technology. Really, it's like we need this technology. And uh yeah, anyways, said too many words to get back to what you were saying, which is we need these non-linear um realizations, because we're at a state, everybody is at a state all the time, we're at a state, we are always needing things that do more than just ameliorating symptoms. And that's
Yeah.
exactly not what you're talking about. It's the very opposite. You're getting at the root cause and the fundamental origins of, as Kevin Boyd loves to talk about, malocclusion and all these wonderful people. And that's
Mm.
that's why I know you all get along so well, is because
Yeah.
the problem is severe, but the answer is early enough. If you start it early enough, you can see extraordinary things happen.
Yes, that's exactly right. It's a really hard problem to fix. You got to think outside the square, and you got to get upstream. I love that concept of the upstream, because this little tool, the BB Munchie, I've got one, I'll just show you. Oh, it's a little coloured one. They're not really coloured. Oh, here we go. Here's a clear one. It's a simple tool, but in the context of the understanding of the clinician holding that, it can be the most powerful thing they do, bring into that system. But the thing is, it's the understanding that makes all the difference. And that's why I've been so hesitant to put that out to the public, because I haven't wanted a parent to think they're going to fix anything with that. You will not fix anything with that little tool. But what you can do is, it can be a great educational piece for a parent who's using the dummy or the pacifier, a sucking tool, to educate them about a chewing tool. It's time for the chewing tool. So for a child that's developing normally and well, it's time to minimize the use of the sucking tool. That's now not the primary functional movement. It's time to move to chewing. So I think it's a fantastic little educational piece for a parent to understand, oh, okay. Oh, I hadn't thought about that. When you start thinking about it, sucking, it's that foundational movement that sets everything up, but we don't use it a lot through life, do we? We suck through a straw sometimes to drink a drink, but most of the time we're actually using other functions, and it's chewing and all that tongue movement ability that is actually the primary functions that are required for the feeding and the speech and all the things. So I think that's a really great part of what's really helpful about this little tool. And then when there are dysfunctions and there's obvious signs of dysfunction, then in the hands of a practitioner and advice and a bit of support, it's a fantastic tool for parents to use at home, understanding what else they need to do to be able to get that child to make a shift in their trajectory of how they're tracking and what else might be going on. It's when you talked about it, when I developed this, because this is what I developed. So my dad was the developer of the Myo Munchie products, which we have we have a mini, a junior, a tween, and an adult before above the age of 2. And when I took over, I started to sort of realize that, gee, even starting at 2, it's kind of, you start to realize that actually it's there way before 2.
Yeah.
And then I was working with a dentist, an amazing dentist in the US called James Bronson. He does a lot with ALF, and he's one of the big educators in the ALF field. And he said that he'd cut down a mini and he put it in a 5-month-old baby's mouth. And this baby, all of the sinuses, all this gunk came out of the sinuses, all this stuff started to happen. And then the baby turned a corner. The baby was really struggling massively, couldn't feed, all the things. And I was like, okay. So a baby will, because you never know what a baby's going to do with anything, do you? So I thought, okay, well, I'm going to see if I can produce a smaller one to see what the babies will do. And it's a slightly different design because it's neurosensory in what it's trying to do.
Yeah.
The brain is mapping. At this point, we don't have dysfunction in the brain. The brain has a program it's trying to lay down, and we're just trying to get as the optimal motor sensory plan, best mapping we can of this lower third of the face. And so these little prongs that are on there are fantastic, because the nerve information for the lower third of the face for sensory is the trigeminal nerve, and the nerve information for the motor activation of chewing is the trigeminal nerve. So it's fantastic. This does sensory with all those little prongs, activating and creating all this information to go back to the brain. And then the motor program, which is sending down all the motor control information, gets activated for chewing, because it's a chewing device. So it's pretty cool for babies. This is like the perfect thing to really get that activation. And when you see the babies interact with it, they love it. They put it in, they pull it out, they put it in, they look at it. They're so interested. Their eyes light up. And it's what we want to see. At a baby at 5 months of age, everything goes in their mouth.
Yeah.
So that's what we want to see. And if they're not doing that, then that's telling us that something's not quite clicking in as well. If a baby's not putting that to their mouth, if a baby can't have that all the way in the mouth. It starts telling you things. They keep pulling it, thrusting it out with their tongue, or they're not comfortable breathing through their nose. Oh, interesting. It starts to tell you things.
Yeah.
But it's anyway, it's a really cool little tool, and it can make a big difference for highlighting the dysfunction and also giving you a way to approach it, because it's really hard to teach a baby all those things you want to teach them about how they should use it. You shouldn't have your mouth open, and poor parents worrying about babies' mouth breathing, you know. It's it's trying to give them good information and simple tools that they can use.
That's so great. I love that. And it's for is I know you told me this, but is it for 3 months and older? Is that
In the hands of a therapist, they might use it at
yes.
3 months.
Okay.
I personally say 5 months,
Yeah.
because every baby at 5 months is going hand
Yeah.
to mouth, and I want the baby to manage it. I have got therapists that I know that use it younger, but they're very much using it within their absolute expertise.
Yeah.
Yeah.
That's so great. But yeah, just thinking, I know especially um caring for infants, it's like, you know, um caring for the newborn is so different than the 2 week old, is so different than the 4 to 6 week old, is so different than the 2 month old, 3 month old. And then when you get to 6, it is a whole different game. So I think the 5 month old, there's is a massive timing importance there with so much, and I think of I have a few questions that I've been percolating on, but I didn't feel right at the time. And now I realized, oh yeah, you opened the door for the segue of it. But it's like so much is happening in that month ish, 4, 5, 6 of where they're moving positionally, going from, you know, spending all this time in tummy time, hopefully, and crawl. And of course, they're still doing that, but then they start to sit and, they start to experiment with that. So it's like, these are this is like this, the 5th month is in that. And of course, the earlier times are wonderful with proper supervision, but I think how beautiful and wonderful to have this tool, to inform development so significantly at this poignant age. And I'm sure
Yeah, and
that's
the other cool thing I've seen with it now is the eye hand, the mouth hand awareness. You know, babies are often really messy. Oh, my light just went off. I had a spotlight on, but it's obviously died. That's okay.
no, it looks still good.
It's okay. Is Now, what was I saying there? Sorry, lost my train of thought. Oh, yeah. So babies can often be very messy. Well, babies are very messy with eating.
Yeah.
What I've seen is little children, 18 months of age, who've been using a baby munchie, awareness of food around their mouth. And I am seeing this kind of 18-month-old, 2-month-old, 2-year-old with so much amazing oral awareness.
Yeah.
All that food's going right in the mouth, and anything that's ending up is getting picked up by the tongue. I'm like, that is cool, because what we're often seeing with these kids is so much lack of awareness. Mouths resting open, no awareness at all around the oral space, food going everywhere. They're chewing, speaking. There's the chew, swallow, breathe, that ability to chew, lips together. And Sharon Moore, who's another amazing, she's a practitioner in Australia, speech pathologist. For those who don't know, get on to Sharon Moore's work. That's something she really, when I was at a conference of hers, that the top lip should engage should be the controller of the movement of chewing. And so what's happening with a lot of kids they're chewing with their mouth open. The top lip's not even engaged at all. It's sitting up, and there's food. It's all over. There's air going in. There's no awareness of the synchrony of chew, swallow, breathe, the coordination that should be occurring, and the tongue lack of, So that lack of awareness, the lack of chewing faculty, really good awareness around where the tongue is, where the lips are, how they should rest together. When you're mouth breathing, you've got no awareness that your mouth is sitting open. There's nothing, no feedback to the brain about that. It needs to be engaged for it to become the norm. Yeah.
Yeah. No, I think of so many things you're saying there. So I know Kirindi Ong. I don't know if you know her. She's Kirindi Ong is an amazing SLP with a lot of myo emphasis, and she's in the Houston area, and we've collaborated quite a bit. And we spoke at the same conference a few years ago down in Orange County, and it was that was my meeting of her, and she's like one of the biggest advocates of the Myo Munchie. And I'll speak to this for a moment because so she's not only approaching like the SLP work from like a lot of awareness of the orofacial complex and the issues that we're having, but she's also seen a lot of um, you know trauma and brain abnormality patients that are the kids that they're struggling because of these severe issues. And so she's kind of that's why her handle is Myohacker SLP, because she's like a biohacker but myohacker.
Love it. I love it. That's great.
Yeah, and I call her the Swiss Army blade because she does so many different things when she's evaluating somebody that you almost get, overwhelmed. But then you stand back, and we've co-treated before, and then you're like, oh wow. So you reminded me of her because you're drawing in the SLP and feeding and the food and the bolus not getting properly distributed, but then you're waxing back to the chiropractic, the movement, and it's like
Yeah.
that's like this is life when we can think about things in a multifaceted way. Because and even the way you were talking about using of course the Myo Munchie as a diagnostic tool, and then in this tool as well, baby Munchie, right? Is that the right word?
BB, we call it the BB.
The baby, using the
Yeah.
baby as a diagnostic to say like what do you see and what are you not seeing, and how it's way more than the actual material. And although it's pretty wonderful in and of itself, but it's like it's the synergy of seeing what that tool does with that you know baby child, and with the guidance of the provider or parent, like what can we ascertain from that. And in that we have the more somebody looks into that, the more somebody does that. And I think that's like, I think we're at a point where what you do to empower families out there is so important, because so many families, they're not going to they all can't go to people that will help them. Some people don't know who to go to. They don't even know that they need that specialty. um, and then there's finances, and then there's proximity. So you have like a huge outreach where you're putting something in the hands or in the mouths of those who really need it. And it's it's really so many families, because of this, I think there's so many families are becoming so much more aware. And so I have so many families coming in, and they've wonderfully used the Myo Munchie. They've wonderfully used some of these other talk tools and other things to help. And and sometimes I look and I think they know so much because they are desperate to see what will help them
Yeah.
and their families. And it's like you put something out there like that, and those who are hungry for that, those who seek it, they will find it, they'll assimilate it, and they'll like, so it's like the world needs these things, because as soon as it's there, it's like those people who know will find it, and it's just the evidence that it's a need, more than ever.
Yeah, I think so. I definitely think the time has arrived. The public awareness is phenomenal, and that's what's going to create the change. This tsunami of need, and parents really aware, either they've had issues themselves and they want to go, I want to make sure my kid hasn't got the same issues, or they're seeing symptoms in their child, or they're just really proactive, and it makes sense.
Yeah.
This is physiology. This is normal physiological function. Oh, where's the research? I'm sorry, that humans have been doing it for the existence of humans. We can see the research around what happens when you don't do
Yeah.
chewing and movement. It's very clear. We don't need to, and that's what I think is really cool around these products. Everything we talk about is chewing. We are an FDA certified, we've got all the regulatory, we're a class 1 medical device, but ultimately everything we talk about that we do is relating to chewing. Where I'm actually just a massive chewing advocate. However you get your chew factor in is great.
Yeah.
And a munchie is a tool that will help you get chewing into your life, because sadly we are sedentary. And like we don't move enough in general movements. I'm sitting on a big chair here, which is not ideal.
Yeah.
I've got a ball under the desk. I was sitting on a ball before.
There you go.
But compared to the amount of movement we would have historically been doing every day, yeah, we're not going to manage ourselves physically. And we're seeing the decline. We're seeing you and I see that with patients all the time. The impact of their work and lifestyle choices on the way their body's able to communicate from the brain through the spinal cord to the body. Sedentarism is a disaster for, just locks down the diaphragm, your digestion, all as well as the joints themselves. Terrible.
Yeah.
But this is what we've got going on here. If you don't chew is the functional movement, like walking. Chewing is the kind of the thing you've got to do to keep the whole system active. You will affect the way your airway can function.
Mm-hmm.
And that's what it comes down to. Chewing is the functional movement. Chewing and swallowing and nasal breathing, that combination is what keeps that airway functional. And the chewing ultimately will keep your jaw stable and keep this whole system here functional. So it's got optimal space, keep your teeth well rooted into the bone. You need all of that to keep the vertical height, to keep the stability so that there's enough space, as well as the functional movement of the muscle. So this is another thing I loved from Sharon Moore's conference. The same 26 muscles that you use during the day for swallowing, etc., are the same 26 muscles that keep your airway open at night. Mm-hmm. So during the day, if you've got a dysfunctional swallow pattern, you can use all those body movements. We see it all the time, full body swallow, where you've worked out a way to swallow that isn't doing the ideal tongue function. Unfortunately, when you go to bed at night, everything else goes into paralysis. The whole body just shuts down, and the only thing functioning is these things that should be under automatic control around keeping your airway open.
Yeah.
And if they weren't working well during the day,
then
they're not going to work well at night. So it's what you're doing during the day that will translate to the sleep issue. And so that's the work that we can do, is try and educate people to be aware of that. So that, and this is what we're trying to establish really early on, is the chew, swallow, breathe. And using it as a diagnostic for the practitioners. And like you're in my mind in the genius kind of category. You're one of the people who can not only see it, you can tell people about it. And so that's what I struggle with. I'm sort of seeing what I see, and then people want to, how do I teach people about that? Because it's really, it is so much of just in our way we approach. I'm not always linear in what I'm thinking of how I approach. I'm just taking in what I see. I'm putting different inputs in and seeing what happens. But I love what you put together, what you're seeing. You've been able to, synthesize that into a map, and I'm very excited to learn more about what you're doing, because that gives me, I'm very generalist in what I do. I'm kind of out here and tapping into all the different things, whereas you're very, you've brought a lot of things together, which I love.
Yeah, and I love the way it's macro and it's fundamental, what you're talking about. And it's like we need that, because those are that's the scaffolding of daily life that makes the difference. And we can do a lot of things, but fundamentally, and you just reminded me. I know there's a lot of other ones that you could be on, but there's this. I'm gonna have to talk to Molly. She's the Sleep is a Skill. She's got this podcast called Sleep is a Skill, and just what you talked about with there's so many concepts that we can say that what you do in the day sets you up for the ideal night of sleep. But talking about it from the chewing perspective is, she's not heard that. So I think that would be, I'm gonna have to recommend, if you want to do that, to her.
Yeah, love to,
That'd be
love to.
brilliant. That'd be brilliant.
Yeah.
Yeah. So yeah, as you know, I've been sitting on this question. You'll hear the pun in it later, but I've been sitting on this question, but it's just something I've percolated on for a while too, and I'm curious to know your feedback on this, or your thoughts on this. Oh, it's there's I have like 8 questions, but the one question is, what do you feel like is the most ideal posture for chewing that a person can have? And maybe you'd say a young one, and then maybe you'd say an older one. If there's different answers for different age groups, please tell me that. But what do you
No, so
feel? Yeah.
yeah, no, in relation to,
Okay. So you kind of like you know, as you were talking about sedentarism and
yeah,
how
yeah,
that can lock down the diaphragm and the digestive system,
yeah,
you
yeah,
know,
yeah, yeah.
I wonder, um you know, it came to me via L5 a little bit ago in this conversation, although I've ruminated on this topic for years. And I think, you know, I think a lot of us, you know, well, you know, L5, when we're sitting, it goes into what we take is that disc and the lumbosacral joint, right? And we turn it from its ideal upright vertical expansion, and then we create this L shape, right? We put a flexion into that joint. L5 sacrum is, you know, innervation to the large intestine,
Mhm.
especially parasympathetic innervation, where we're talking rest and
Mm.
digest. So I don't think there's a one answer for this, but you know I'm going, right?
Yeah, yeah, yeah. No, it's great. It's great. It's got me thinking, that's for sure. Yeah, love it, love it. Yeah, you're really making me. Well, I'm
And
gonna have to
here's
stop
why
writing
here's
that
why I
one.
mentioned it, because,
Yeah.
you know, yeah, there are those times when I'm evaluating the pterygoids and I'm evaluating the masseters
Mm,
and the chewing of these, you know,
yeah.
children, you know, babies, you know, young ones, toddlers, you know, adults, TMJ, you know, all of the permutations of why we might end up checking this mechanism of,
Mm,
you know, chewing. And then I'll say, okay, let's get you standing. And I have them stand. Then I check all the cranials, all the facials, floor of the mouth, and all the way down standing. Check the
yeah.
diaphragm standing. Then I'll have them sit down. And if they've got
Mm,
a rigid diaphragm, if they've got a tense diaphragm and they sit, it rarely ever gets better. It only tends to get worse. Obviously, we're talking about a compromised system
yeah.
versus a
Yeah.
functioning diaphragm. And
Yeah.
so when I take them and put them sitting, and then I check, you know, temporal bones plummet. You know, the temporal
Yeah.
bones
Yeah.
misalign. It's
Yeah.
that right
Absolutely.
one more so than the sphenoid locks into some whatever it's locking into, and you know, pterygoids. So you know, on my map I show that the left pterygoid is almost always tighter than the right. Left medial pterygoid is usually going to be more restrictive than the right on all of us who have pharyngeal arch issues. And
Right.
in the end, it doesn't really matter, except, you know, I think there's also sitting in a chair versus sitting cross-legged on the floor, sitting on a
Yes. Yeah.
cushion
Yeah.
on the floor, right? And when
Yeah.
you talk ancestral, and it's like, well,
Mm,
how many
mm,
civilizations, the Japanese cultures, some of us who,
yeah.
you know, my wife is more, my wife, you know, Dawn is, you know, from California, but she spent 3 years living in the Middle East, in Israel and Palestine. And
Mm,
they spent so much time, and even in our travels to Morocco that we've done, North Africa and Morocco, you sit on these cushions on the floor,
yes.
and there's
Yes.
something, the L5 functions very differently when you put it
Differently.
on that. And so I wonder
Absolutely.
about some of this with, it's like, you know, and then so sometimes, you know, it's nice because if we have those wobble like little pillow cushions, we put them
Yeah.
under our bottom, and we can have
Yeah.
that functional movement in
Yeah. Yeah.
there.
Yeah. Because it is about getting into that anterior tip, isn't it? That's
Yeah.
what's when you sit. That's the whole problem with these chairs. The whole system deactivates.
Yeah. But you
Whereas
know,
when you
most
can
of
get,
yeah,
yeah.
but most of us tend to like fidget in our chairs and move around. And I don't want to
Mm,
like blame the, or say like that's relegated to a sensory problem. I just feel like who doesn't have a sensory problem in this world, right?
Yeah.
We're all
100%.
sedentary, sitting in
Yeah.
chairs
Yeah.
that
Yeah.
aren't the best place. So I think most of us rock in our chairs, and our kids do
Yeah.
too. And it's like, that's good. I'm always doing this. But I mean, like,
Yeah.
I think we're figuring it out. I think a lot of people do. And truthfully, I don't want to vilify the chair, because um but this is the tension I think about. And this is why I wanted to get into this conversation with you, because you're the right person, is that there's such a value of families coming together and sitting at the table and
Yeah.
having a meal. And in fact, there are great studies that show that the amount of satiety and the amount of satisfaction, richness, and the chewing, and it's enhanced when people sit. It's better
Right. There you go. Yeah.
versus when
Yeah.
people are not sitting together at a table, because it's about
Yeah, when you're on
community.
the move. Yeah, yeah, that's right.
Yeah.
It is more just, in my family, we call it transitioning to the floor. I'm I'm trying to find more opportunities to get on the floor.
Yeah. Yeah.
So, and that would be the thing if you've got small children, is try and have your dinner around a lower table, so you are getting more of that opportunity to sit in that cross-legged
Yeah.
on a little cushion of some sort, because they get that anterior tip, which does then work better from the L5 perspective, as well as really interesting. Definitely around that, the pelvic SI
Mhm.
joint. You're going to
Yeah.
lock that up when you sit, when we
Yeah.
sit back, and that's going to lock up T&J, which is going to
Yeah.
affect the chewing function. Yeah, so you're right. You're definitely onto something there, as far as so I would say, just in light of what you're talking about there, that that you're definitely going to get a better opportunity or access to that ideal function if you are in a situation where you're sitting more tipped forward than the slumping back, where
Mhm.
you're getting that opportunity when you're forward on the sit bones, and you're allowing that space and the opportunity to pelvic tip forward and open up diaphragm, hopefully.
Yeah.
TMJ, etc. Yeah, good question. So I love it. I love it. Love it. All
Yeah.
the things to
No.
think about, isn't it?
Yeah. Well, I know. Oh yeah. I know we're um I have one more thing, and then you can tell me too, when we're feeling like we're coming to our
Yeah.
end here. I know we were figuring out technical difficulties to start,
Yeah,
and
yeah,
but
yeah.
when we get into this podcast world and we're talking with each other, I'm like, time doesn't exist. Time is
That's
not
right.
there.
That's right. We're
But
going
you
down the
but
rabbit hole.
responsibilities do. So but I was just thinking, that same conference that I was there teaching with Karindi Ong, and we taught with a midwife and a dentist too, who's really wonderful, that does a lot with Alf.
Amazing.
And so that the same one, Derek Nordstrom, came in, and he brought his lasers, and he was there to do some work with oral lace. And so I was teaching, and I was teaching my protocols, and then one of the chiropractors that was there that had attended the training, I was demoing on him. And Derek was going to come in and do some demo with a laser, but Derek, he stops and he says, "Huh," doesn't say a word, says many things without speaking, and he said, "I'm just gonna," and then he goes to the table, and he has the chiropractor lie down, and he kind of tells Amy, the dentist, to he's like, "You could just tell them, translate," because Derek, him, when he goes in deep. When
Yeah,
he's
yeah,
not
yeah,
working on
yeah, yeah,
somebody,
yeah.
he can, like, you two could be brilliant articulators, conversing at the most complex things, but distilling it. And so, anyways, in that moment where he held the head, and then a few of us gathered around, and then I was co-treating with him in that moment, we were like co-riggers in this journey of managing this person's field. And I just had a huge appreciation for um, the state of awareness and consciousness with which Derek lives and
Yeah.
works. And as we, like, in a way, communicated with each other without words about things that were going on within this person's body, it was really wonderful. And so we've stayed in touch, like, often. And I was just talking to him a couple weeks ago after our move to Santa Barbara, and we were just talking about all the things that we want to do in collaboration. So I need to make it down to San Diego soon to go
Oh,
hang
how
out and do
fabulous.
some
Yeah,
more.
I could imagine the level you'd be talking on, which I think is very exciting. I love that.
But I
And
feel like,
that's where the answers exist out
yeah,
there. It's
and it,
you're bringing them in, which is
well,
wonderful.
I can't wait until we get to spend time together in person.
Yeah.
This has been wonderful too, and in our conversations before. And I know I'm getting to uh, next week speak with your group there
Yes.
on my
Yes.
Munchie call.
Very
So I
excited to have
feel
a deeper dive with you, actually. That'll be great.
fortunate for that. So, but there is something really powerful when we, can get together, and so I'm looking forward to that. I really am.
Yeah. Yeah,
But
great.
yeah, thank you for generously sharing your time and your knowledge, your expertise, and telling us about the baby and telling us about your contribution to the lineage of the Myo Munchie and bringing that tool to even be helping with this mission of helping even earlier, which is so important. So yeah, I would love to say what's sort of wisdom that you would have. We have many people, like we have the healers, and let me just say, in the compromise to alchemized journey, we are all healers. We all
Mm,
need to be healers, right? If I'm
mm,
talking to a mom like I did today, I showed her, you know, 3 different moves that each took 2 minutes so she can do these very complex body work moves. Because to a mom who needs to help her child or a dad, that's
yeah.
not complicated. I say, do
Yeah.
this, they do that, it works. It's like
Yeah.
they're ready. So I feel like when I'm asking you to share, I think it's just with the healers in the world, all of us who no, there is greater capacity of healing when we put our minds together. What is something you can lend to this healing collective? What is wisdom that you would like to share? In something that I would just um, challenge you
Mm.
here to say, without saying the word chewing,
That's right.
without saying movement, and without saying
Yeah.
chewing.
Yeah.
um I just think there's something really profound about the way you think. So I feel like this will allow you to even give us a richer explanation. What would you say to encourage us in the
I think
significance?
we well, just you've sort of articulated that there, you're giving that mum the things that she can do at home for the baby. Is just tap into your innate intelligence,
Mm,
your own intuition and intelligence, and
yeah.
your child. Be your child's advocate in the world. Know them, know their health, so you can spot it when something's not right. When you know straight up, they're not themselves. Because I think what can tend to happen is some of these behavioral things and things start to play out and they think that's the child. And a lot of the time there's different things that have created an environment that's the expression of the child. And especially a lot of those behavioral things, as I say. And I think if you just set about knowing and trusting your instincts with your child and your intuition, and then find someone who's going to be your health, the person on your journey with you, a practitioner who, when you've got concerns or questions, that they know you and they know your child well. Like, that's what you really want on your journey with you, is not outsourcing your health care to someone else. Being in touch enough with your own system as well, to know when you're at your peak and when you're not.
Mm-hmm.
And working out what is the dysfunction, what is it that created that, starting to tap in enough yourself to know. And I think that's, with babies, you can definitely, if you connect and spend, you'll know get to know them really well, know their rhythms, know who they are, how they express, they're letting you know when they're not feeling great, when this is going on. And trust that and take that, because that's the biggest gift you can give them, is being on their health journey with them and allowing them to get their optimal genetic expression. And the earlier you can spot where there's an issue, the simpler can be the solution. Don't wait till they're hitting school at 5 to start finding out they've got issues with this, and this, and you've got to start treating symptoms.
Yeah.
That's probably the biggest thing. Trust your instincts, trust your intuition.
Mm-hmm.
You know
Mm-hmm.
them. So when there's a
Yeah.
sign, see the sign, and you know as a parent that that's a sign before it becomes a big symptom that you've got to treat.
Yeah. Well, and I think that's a really one of the most informative and that's really wise. And I think it applies to the parents and it applies to us, practitioners. It's like we all have intuition. We can all be
Yeah.
led and we can all follow and we can all discover what we can't figure out with just our conscious scientific rationale. We need to trust that intuition and instincts and all the things that you mentioned, because when you delve deep, you find out the answers can be there. So yeah, that's wonderful. Well, thank you, Mary. I
And
know.
also just,
Go ahead.
yeah,
Please
making
do.
sure you keep looking. That's the other thing I would say. If you're hitting
Yes.
a wall,
Yes.
find someone who'll take you around it, because there's
Yeah.
often, look over there somewhere, there is a different way. Thank you.
Yeah. No, that's really good too. It's, yeah. And it takes perseverance. And that is, that got us through our earlier technical difficulties, and it's gotten you through staying persistent in your field of helping to enhance this functionality that is so pivotal. So, well, I appreciate what you do. I know that people can find you. They know you. They'll find you with Myo Munchie. That, like, everywhere. It's like you type that one word and you find
Yeah,
you. So,
yeah.
any other way you also want to say where people can know about anything that's coming up or find out more about you? Is there anything that you really want to share other than people coming to your site and things like that?
Yeah, just really, yeah, having a look at our, we're trying to get more clinical support and advice on our Instagram page for direct to the public, more,
Yeah.
and we've got another page called the Oral Milestones page. And so really trying to sort of
Mm-hmm.
have conversations with parents around what ideal looks like. They're trying to find out more information. We want to just have more information there so they can know what ideal looks like, because that's part of the issue. It's not really clear what
Mm-hmm.
ideal oral function looks like. I think everyone's pretty aware of those motor milestones for body movement, but we're trying to be the people who can tell you about what ideal oral motor development function can look like, so that you can aim for ideal rather than
Yeah.
waiting till you've got dysfunction and getting treatment for it. Yeah. So that's
Yeah.
Myo Munchie is our product, but yeah, we've got an Instagram page called Munchie Movement, hashtag Munchie Movement. And the Munchie Movement is the bigger context around what we're about.
Yeah.
Sleep, movement, nutrition, play. That's the big
Mm.
overarching context of what we like to talk to. 4 pillars of what how to create health in your family. And anyway, so that's a lot of what we're about. So go and look us up.
Hey, well, yeah, everybody check it out.
Okay.
Thank you, Mary. And then we are, yeah, very, very, very thankful. And I'm thankful to have this time with you. And for all the listeners, please go follow. If you're not already following Mary, do that. And please, just keep sharing this podcast with anybody you think needs to hear this. In these conversations, we do deep dives and resources are aplenty. So please tune in and enjoy. And I'm so excited to have you along for the journey.